So, what exactly is a formulary, Jessica?
Good question. So I think of a formulary as many things. It can tell us a lot. But a formulary is basically a list of prescription medications covered by a patient's insurance plan. As I mentioned, it may be called something different. It could be called a prescription drug list or a drug list, but they are one and the same. And we argue that patients who can read their formulary may hold the best kept secret in navigating their care. So we'll dive a little bit deeper later on, but as to how this will become a valuable tool to you, but it is a very important one.
So, what you're saying is that it's basically a book with all of the drugs or medications that your specific insurance plan covers. Is that right?
Yes, yes, but there's much more to it. Also, it's important to note that although some insurance companies do send you a physical copy of this, your formulary, you should be able to access the information online, as we mentioned earlier, with the different methods that we spoke about. So let's go ahead and talk about these other things that I've been mentioning. What does the formulary tell us? We know that formularies tell us about medications, but they also tell us which medications may require more steps for you and your healthcare professional to take. Often these are noted in abbreviated terms in the formularies. It also shows patients how much medications are expected to cost. Remember, time is money. This is where the cost implications are. But what's important to know is that insurance companies sort the medications they cover into different financial buckets. They call these tiers. These are very different from one insurance plan to another. So it's important that you look at these in order to figure out how much the cost of the medication will actually